Hello, hello, hello. This is Coach Robin Michele, and I am here because we are doing a live this evening on people starting their own home health care agency. So, if you are interested in starting your own home health care agency, this is the time for you to come on and ask all of your questions. So come on in, everyone. We are talking about starting your own home healthcare agency and what you need to do to be successful. My name is Robin Michele. I have been an entrepreneur for 34 years, and I am here to answer any and all questions. Hello, hello, hello. Welcome, welcome, welcome. We are talking today about starting your own home healthcare business. Hello, thank you for joining. We are talking about starting your own home healthcare business and what you need to do to be successful. This is the time for you to ask any questions that you have. If you are interested in starting a home healthcare business. If you do own a home healthcare agency, I want you to comment in the box and tell me what it is, the name of your agency. We are talking to home healthcare agency owners or people inspiring to be a home healthcare agent. If you are thinking of starting a home healthcare agency, or if you have one, I want you to comment the state that you are from. And if you do have an agency, let me know. Thank you for the hearts. Yes, tap the screen. Yes, my name is Robin Michele, and I am in Pennsylvania, and I have been in the home healthcare industry now since 2023. I was able to make my first $1.1 million in my first 7 months without paid advertisement. So I am here to show you guys, number one, the ways that you can get clients and get clients fast. And also to go over some hidden things that people don't talk about in the home healthcare agency. Thank you very much for liking this live. This is actually my first live that I'm doing for the home healthcare industry. You truly have to be a compassionate person if you want to be in this business, because I'm going to tell you, you can make a lot of money in this business, but it can be at times, I'm going to be honest with you, it can be very stressful, especially when you're first starting out before you have staff. Because you are doing everything. You are the receptionist. You are the marketer. You are the payroll person. You're interviewing clients. I think the hardest thing for me, even till today, because I have clients that will start calling my phone 7-something in the morning. You have to have patience with your clients. Because what I've come to find out is you have to get to know each and every one of your clients and find out what their needs are. And like one client I had, she was paralyzed, and she was paralyzed for over 20 years. And I went through 16 aids with her in less than a year. You sometimes have to train your clients how to be good to the caregivers, because your caregivers are very important. Number one, your caregivers can make your business or break your business. And I'm going to tell you why. If your caregivers are just doing it for the money and they don't have compassion for people, they're not going to last, because it can be very challenging being a caregiver. Thank you very much for liking the live. And please go up and get your deli hearts, guys. Grab your deli hearts and actually become a fan, so you know when I am going to be coming on live again answering questions. So let me see you. you're in the live. Tell me, what state are you guys from? And do you currently own a home healthcare agency, or are you thinking about starting a home healthcare agency? This is a live Q&A, and I'm here to answer any questions that you have about starting it an agency. Are you looking for waiver clients? Are you looking for VA clients? Are you looking for private clients? How do you go about building a silent pipeline? How do you go in? What do you say when you're calling these rehabs? And you want to start building relationships with people in nursing homes and rehabs. Hi, Pat. How are you? Thank you for coming in. Thank you, Calvin. Thank you for coming in. Thank you, Robin. Thank you for coming in. This live is about starting your own home healthcare agency and questions that you may have. Please share any questions that you have, and please tell me if you are starting out. Okay, so I see you're just starting out. Very good. Do you have any clients as of yet? And what state are you in? What is that? Strat RN? What state are you in, sweetie? And do you have any clients? Another thing, branding. What is your branding? That's very important when you are an agency. You have to know what your branding is. You have to know the clients that you are serving. Okay? You should be able to sit and in one sentence say who you are and who you serve. Thank you, Nell Flavor, for joining. Thank you for coming in. Thank you, everyone. No clients as of yet, and I'm in Michigan. Okay, you're in Michigan. Okay. How are you doing your marketing? Have you started marketing as of yet? And if so, how are you going about your marketing? Thank you guys for the hearts. Thank you, and please go up and grab your deli heart for the day. We want to get this room warmed up. Okay, because marketing is key. Are you are you able to take Medicaid clients, waiver clients? I'll tell you that if you're going to be taking waiver clients, especially if the clients are just starting the waiver program, that takes about a good 45, maybe 60 days. Because first thing they have to do is they have to get approved from the doctor that they're medically eligible. Then they have to go through the county assistance office and show that they're financially eligible. And the county assistance office is what takes the longest. I'm approved to bill Medicaid. Very good. You just got approved. Well, congratulations. That is good. What do they pay an hour in the state of Michigan? Because it's different through every state. In Pennsylvania, I think we're probably one of the lowest states. We get paid $21.35 an hour. Guys, please go up and grab your deli heart. And also become part of the fan club so you know when we're going to have this live. Wow, you guys get $27 an hour. That's really good. And what are you thinking about paying your aides? That's awesome. So for private pay, you guys are probably up to like $40 an hour? Hi, Tay Day. Thank you very much for joining. $27 an hour is good. That's good for waiver. I don't know why Pennsylvania. I don't know why we're so low. Hi, Tay. So tell me, Tay, are you a home health care provider, or are you thinking of starting your business? This is a chat for Q&A to ask any questions that you have about starting a home health care agency, or if you have an agency, how to increase your clients. Guys, go up and grab your deli heart for the day, and please keep tapping. Let's warm this room up. I appreciate all of your support. This is the first live I'm doing. I am a case manager as well. The state pays caregivers $17.13 an hour. Okay, so you're making like $9 an hour. So you're looking at probably after taxes, workman's comp, and everything. You're clearing what, seven between $6 to $7 an hour. How do we get private clients? That's a good question. What state are you located in? The person that asks, how do you get private clients? Now, to get private clients, is a couple ways you can go. One of the easiest ways is number one, to start going to your luxury senior assistant living places and marketing in there, or find out the apartment buildings that have a lot of seniors that live in it and start passing out flyers. Get to know the doormen. And you can get private clients that way. You can also get private clients through workman's compensation. Workman's compensation is really big. I'm actually going to be doing a couple of videos, giving out a couple of companies that you can actually reach out to, like Aflax, Progressive. They all have workman's compensation departments in them. You call them and you find out who handles the workman's compensation. I actually have a list. What systems do you use to educate your caregivers? We use HHA. And they actually have to go in and watch 25 different videos and complete the training. And then they get certificates for once they complete it. Our training, which I think should be a little bit longer, but to go through the training in Pennsylvania really would take somebody about 3 hours. It's not a lot of training that they do give, but I will share this with you. If you're going to be offering more hands-on training in your state, you want to get in contact with your labor board or the Home Healthcare Society, because they have different programs that they will compensate you for training your caregivers. And that's another way to have a stream of income coming into your agency. I actually have a video on that if you go back and look at the video that I have. So that's what we use to do our training. Now, how about in Michigan? How do you guys do it? Thank you for the hearts, guys. Thank you for the tapping the screen. Please share this out. Do you have the list available? Yeah, I have it available. I don't have it on me just a second. If you send me a DM, I will get that information over to you. Just let me know exactly what you want. And is that for the caregivers? You want to know about the caregiving programs where you could get compensated for training caregivers? If that's the case, just send me a DM. Now, how are you guys marketing? Oh, for the private pay. Sure. I'll send you some tips on where you could go to do, get some private pay clients at. Absolutely. And, you guys also may want to go down to, in Pennsylvania, it's called the Philadelphia Aging Corporation. Find out who your corporation is that handles the aging. Like, say if you have a complaint because you think a senior citizen, they also have, they finance caregivers, and a lot of those people are private pay. So you may want to find out who handles that in your state, and you could go down there with some flyers and pass out information. But the apartment buildings, the senior living facilities, in your higher end neighborhoods, what we actually did is, instead of getting business cards, I get postcards. And we actually have a street team that we have go out and put the postcards in actually people's doors. So, go to train stations, because people are at work and it's all these cars parked in the train station. Put them in the train stations. Put them on the cars at the train stations. That's another way to go. The supermarkets are a good place. Drugstores is a good place. You got to be willing to take the time and go in the streets to get these clients if you want the clients. Any other questions that you have? Guys, go up and grab your deli hearts for the day. I would truly appreciate that. Also, you may want to look into doctor's office, uh, urgent care places. You can go to. Thank you very much for being the fan club. Thank you, thank you, thank you. You can actually go to urgent cares, and you can pass out as postcards and brochures as people are coming in and out of the urgent cares. You can get some private clients that way also. But if you really want to get private clients, you're going to have to do some marketing. I would say find like that local newspaper that goes into hospitals, and that free newspaper that is everywhere in the community, and find out how much it is to do advertisement on that. But what I also recommend you guys to do is to do your Google profile, and make sure you have a Google profile set up so people can find you on Google. Make sure you're in 411. So when people go search for home health care agencies, they'll be able to find you in the directory. You want to also reach out to the hospitals. Start reaching out to the social workers. And I'll tell you this, you got to be really patient when you're calling the hospitals and the different rehabs, because they're really busy. So 9 out of 10, when you call up there, they'll be like, oh, send me an email. Make sure you get the person's name you're talking about, and then you get the email, and you start a drip email campaign and send them out like an email twice a week, and then follow up with them. Can you do all this before getting the approval from the state? You mean actually getting your license, or getting approved to be able to do Medicare? I'm not understanding what you're saying. Before you get your license? Well, I can tell you that before you get your license, I would not recommend that. Now, you can be a private caregiver. So if you're going to be a private caregiver for someone until you get your license, you can advertise that way. Another good place to advertise is an app called Nextdoor. Guys, grab your deli hearts and grab your fan club so you can know the next time that we're going to have a live. The Nextdoor app, you can post in there at least, I would say, start out every day, like twice a day, and then go to like 3 times a week, because you can get a lot of private clients there. I get a lot of phone calls for the app Nextdoor. Welcome for coming in. Thank you for coming in. This is talking to people, Q&A for home healthcare agencies. I have half the stuff put together, just need to pay the $375 for the license. Yeah, go ahead and get your license. But guys, I can tell you also, while you're waiting for your license, what you can do is you can also partner with another agency and say to them, hey, I have a couple clients. I'm waiting for my license. I would like to for you to service my clients. You guys work out an arrangement on how you're going to split the money. And just let them know I'll give you 30 days notice, before I move the clients. Thank you. I have a home health care agency in Pittsburgh, Pennsylvania, and also Houston, Texas. I need help. Oh, well, congratulations. How many clients do you have in Pittsburgh? But what was I saying? Back to what I was talking about. You can partner with another agency, and work with them. That's what I did, and how I worked it out is that I got an override for, I would get the caregivers, I would manage the clients, I would do everything. Basically all they were doing was the billing. And as they were doing the billing, and I was managing everything else. Thank you. So for Pittsburgh, I have 15 at 150 clients. In Houston, very okay, nice. Oh, Houston, you don't have any. Okay, well, you got to start marketing. You got to get yourself a street team. Let me tell you guys, if you develop a street team, okay, how you can motivate people is you get you some recruiters, okay, and you can pay your recruiters. I'll tell you what I do. When you bring on the client, it's one or two ways I do it. If you bring on a client, I will give you $300. If I have a recruiter and they're bringing on clients consistently, what I do is I give them 20% every month on what I make off of the clients after expensive to help them build up a residual income. And when people start doing that, yes, I do one-on-one consultations. If you're interested in a one-on-one consultation, you can book that with me. They will start to create passive income. And even if it's like, I have this one girl, I have a client and she's 56 hours. She gets $168 a week. And what they do is they follow up on the clients. They call them once a week. You train your, at your convenient times, can you message me? It's not allowing me to message you. It's not allowing. Okay, so I just followed you back. Let me see something. Let me take a screenshot so I can save you. And I just followed you back, so I should be able to follow you. I don't know why it's not letting you message me. Where are you located at? Did you already tell me? God is great. Welcome to the chat. Guys, go up and grab your deli heart. We're trying to warm this room up this evening. Good afternoon. Welcome, Miss P. Thank you. Okay, you're the one that's in Houston, Texas. Okay, Houston, Texas. Yeah, you got to start doing your marketing. You're going to have to get you a street team. You're going to have to get some people out there. Go ahead and get you some postcards made. You can go to Vistaprint and order you a bunch of postcards. Start going to the Social Security office. Start going to a big place to go to, especially if you have your license, is the welfare office. Find out which welfare office is the main one that handles the waiver applications, because you have multiple welfare locations, but you only have one of them that handles all the waiver applications, and they forward it to them. Find out which one is the main one. Go down there. When I go down there, we spend about 2 hours a day. We walk away with anywhere between 5 to 8 leads a day. Go to the free health clinics. I definitely am going to find out. Thank you. And definitely going to find out. Find out where it is. Cause we're in Philadelphia. So ours is at 52nd and Parkside. And like I said, we go down there a couple days a week, and you're walking away with an easy, 10 to 15 leads a week. And all you have to do is follow up on your leads, call your people. And guys, let me tell you this also, especially when you're first starting out. My license goes to Philly too. Okay, very good. When you're first starting out, when you call a client, they may not sign up the first time you talk to them. Sometimes it takes a couple times for you to follow up with people and talk to them before they'll actually follow up with you. Guys, welcome. This is a Q&A about starting your own home healthcare agency. Guys, go up there and grab your deli heart. Please grab your deli heart. That helps supports me as the person that's doing the host. And it'll also give you a reminder when we're coming back on. Hi, Lisa. Welcome to the chat. What's the name of the app you previously said? Oh, Nextdoor. If you go on to the App Store, just text in Nextdoor, and it'll come up. And you put your information in there and you can join different groups. But I get a lot of phone calls from Nextdoor. And guys, I'm also going to yes, and please share. Thank you very much, DeWall, for sharing the live. And yes, guys, if you could share the live, let people know that we're talking, get them in the room. Let's warm this room up. Come on, ask your questions. I'm here to support you guys in building your agency and getting to the next level and marketing your business and getting private clients. As I just said, it's a few ways that you guys can get clients. I recommend everyone that has an agency to go to sam.gov and apply for what's called your cage code. Once you get your cage code, that's an identification number you're going to get, like your EIN number. That's going to allow you to get VA clients. VA clients are very big once you get into their network. You want to go after workman's compensation clients. All the insurance company has workman's compensation. I'm actually going to be giving out a couple names next week. Believe it or not, Walmart, there's a third party that handles Walmart's workman's compensation. If you get into them, you call them and tell them I'm a home healthcare agency and we provide in-home services for people. And you get into them, you could get private clients that way also. Welcome, Princess Black. Welcome. Welcome, Ellen. Welcome. Kim, welcome. Destiny, welcome. We are talking about building your own home healthcare agency. I am here to answer any questions. You guys grab that deli heart and keep tapping the screen. Share this out to other people. We want to let other people know that we are here. We are trying to support as many agency owners as we can to build your revenue and to start building a solid pipeline. If you do have an agency, guys, tell me what state you're in and please share this out. Thank you for sharing the live. Thank you. Yeah, share the live, guys. I was actually starting to do it, but I was inviting people in, so I got to be careful because this is my first time doing the live. Guys, please grab your deli hearts. Please grab your deli hearts. So let me explain to you another way to get clients and get clients fast. If you started an agency, go through your cell phone. Start sending messages out to people and tell them, hey, I just opened a home healthcare agency. You know, we are available 24 hours a day. If you need any help, or if you know anyone that needs any help, tell them to reach out to me. You will be surprised how many clients you will get from your warm market. My first year in business all came from referrals. I'm gonna be honest, I still don't even do any paid marketing because between my network and reaching out to different facilities, I'm always having phone calls coming in. But another good thing to look at in your area, welcome Digital Wealth, welcome Sandra. Another good thing to look into is a billboard. Guys, please tap the screen, show your love. That motivates me and makes me want to talk more, and share this live and let people know to come on in. the home healthcare industry is just going to do nothing but grow bigger and bigger every year. Over 66 million people are on Social Security. So that tells you a lot. There's a lot of clients out there. You just have to know where to find the clients from. Thank you for coming in, everyone. Welcome, welcome, welcome. Welcome. I walk in faith. Welcome. We are talking about, we're sharing tips on how to start a home healthcare agency. If you are thinking of starting a home healthcare agency, or if you have one, please tell me what state you in, how many clients you have, and what issue are you having in your home healthcare right now. Where do you need help at? Where do you need advice? Let me share this with you guys too. Don't try to do everything yourself because you're going to burn yourself out. Look into getting yourself a virtual assistant. You could go to places like Upworks, Odesk, or Fiber, and you can get you a personal assistant for less than $5 an hour. Oh, I walk in faith. You're in New York. Okay, so do you have an agency in New York? Because I heard it's a lot going on with the home healthcare industry in New York. Okay, so we have someone in Minnesota. I have 8 clients. I had more. What did this say? I had more, but they went to nursing homes or passed away. Yeah, I had a client that passed away. That broke my heart. But I actually had to let that client go because the daughter, you said walked in faith. I text you today. Okay, I'll go back and check. If I didn't text you, I will text you back. I had a client that passed away, but she wasn't my client at the time because I actually had to let her go because her daughter was interfering with her care. The daughter would stop us from taking the mother to the hospital. And I come to find out that she only wanted her mom to go to the hospital when she knew they was going to keep her for at least 5 to 7 days. Yes, you do, but you want to talk it on Zoom. Yes, you do, but you want to talk it on. Yeah, I am actually going to be doing some Zoom classes and talking to people about building your agency. Yes, you do, but you want to talk. Oh, okay. We're going to talk on Zoom. Okay. All right. Am I supposed to be, are you the one where I'm going to be dropping a link? I'm supposed to be sending you my calendar link, I think. I got to go back and I got to grab that link. It's been a really busy day. Guys, please go up and grab your deli hearts and become a fan member. That way you will get notification when we are going to be doing these lives. Now, guys, I'm going to be trying to do the live every day at 7 p.m. Eastern Standard Time. So if there's something that you want to talk about, make sure you send me a DM ahead of time. Like, say, if you want to know about the workman's comp and you want me to go over a few companies that you can reach out to, send me a message. That way, when we come on to the live, I will be prepared for you guys. Thank you very much for joining Pokey. Thank you for joining the live. Come on in. Thank you everyone for joining the live. Thank you for your support. Please keep tapping the screen, showing your love, and please go up and grab that deli heart right up at the top. That is showing your support to me as your host. I appreciate it. And if it's any questions that you have, please drop your questions in. I will be more than glad to answer any questions that you have. Bear with me because this is my first time doing a live, so I am a little nervous. I got to get comfortable with doing the lives, but I'm here to answer any questions that you have. I will tell you, marketing is really big when you're doing a home healthcare agency, building relationships with rehabs. I tell everybody to go and Google all the rehabs in your zip code area. and start calling them. Hey, my name is Robin Michele. I'm calling from Healing Hands. Just want to know if I could possibly set up a meeting to come and speak to you and your team to let you know about the services that we offer. We are right here in the community. We're available 24 hours, 7 days a week. We help people with their waiver services from A to Z, and we're able to get our clients started within 24 to 48 hours. You want to do that. You want to call places 62 years and older and ask for the activities coordinator and find out about going in, doing some activities. Bingo is big. They like to do bingo, and you could go in and do bingo, but before you do the bingo, you can make a presentation, let them know about your services. I will tell you, when I went into one facility, they told me they were very impressed because no one ever took the time to answer any questions for them. Let the people talk. Let the people ask questions. Take your clipboard, get everyone's phone number, get everyone's email address so you can follow up with them. But the 62 years and older is a good place to reach out to. The rehabs are good. You want to reach out to your local hospitals. If you can't get through to the social workers, go through patient relations or ask for the administrator of the hospital and tell them you have been trying to do a meet and greet with the social workers because you are a home health care agency in the community and you like to be able to provide services for their clients. You want to reach out to dialysis places. That's another good place to get clients. Thank you. Rebecca joined. Please, guys, invite people out to this live so people can come into the live and get as much information. Please drop your questions if you have any questions about marketing or advertising or starting your business. If you're having obstacles, let me know what they are so I can see how I can help and I can address you. I can tell you now the biggest complaint in the home health care industry from clients that I bring on are the caregivers. They complain about the caregivers, not my caregivers. They complain about caregivers and how they come in, they just sit on their phone and they don't do any work. You got to make sure you train your caregivers. I see you want to learn about marketing, not a problem. I'll go back and talk about some marketing, or we can set up a one-on-one call about marketing. You got to train your caregivers, not just on the state requirement, but what your requirements are. Thank you very much for sharing the live. And guys, thank you for tapping the screen. And please go up and grab your Deli heart that supports me as your host, and join the fan club so you can get notification when we are having this live so you can come and you can get educated. But you want to train your caregivers. Now, I'm going to tell you guys what I do. And if I knew how to share my screen, I would show you. But all my caregivers, I work out of WhatsApp, okay? And I have one WhatsApp for announcements, one WhatsApp chat for announcements, one for schedules, and then I have one for each client, like Michelle Robinson, Mr. Terrence. And when the age starts to work for me, they join the chat. What they have to do is when they're doing their chores, they have to take a picture after they finish their chores. When they're making the client's meals, they have to take a picture of cleaning the meals. If they're doing the laundry, they have to take a picture. They have to give me a summary of what went on through the day. Because that allows you to keep up with your aides and keep your aides on their pins and toes when they know that someone is actually watching. Also, you want to do spot checks, okay? On your homes, okay? Especially in the very beginning. Really throughout your whole time in business, you want to do spot checks and see what's going on with your clients. You want to call your clients at least every other week to find out how things are going. Find out how it's going with the aides. That's a big thing. If you don't have the right match with the aide, one or two things is going to happen. The client is going to leave, or you're going to have a rotation of aides. Okay, so my recommendation to everyone, this is what I did when I first started out. Thank you very much for the hearts. Thank you for the hearts. And guys, grab your deli heart up at the top. When I first started out, I would service each of my clients myself. So I knew the clients. I knew what their needs are. Also, what you want to make sure you do is make a checklist with the client of everything that aide needs to handle throughout the day. Advice on starting a home care agency. Ask your questions. Okay. Yes. Make sure you have a checklist. Go over the checklist with the client before the aide starts. Like, what time do they like to have breakfast? What is the things that are the client's pet peeves? You want to make sure the aides respects the client's homes. I've heard people say that they would eat their food, they would take stuff out their house. You got to make sure you're not just hiring people to hire them. You got to make sure you do a good background check on your aides. And even if your state doesn't require it, I tell you to do fingerprinting, even though you may never use it, but that's just like an extra security that the aides know. Oh my goodness, they have my fingerprints on file. So that's another good tip. But guys, ask your questions. We have quite a few people in here. Where are you guys? What state are you in? Do you have an agency? If so, how many clients do you have? And please go up and grab your deli hearts. Grab your deli hearts. I would truly appreciate your support. Now, someone asked about marketing. Now, when you're first starting out, I recommend that you do not, good evening, Golden, do not start out with paid advertisement, okay? Because all that's going to do is drain your pocket. I recommend that you get in the trenches, that's what I call it, and you get out there and you work the streets. I don't do business cards. I do postcards. I wish I had one. I make postcards and I design both sides of the postcards. And I go out to the welfare places, doctor's office, drugstores. Drugstores will even let you leave some of your postcards in there. I go to apartment buildings 62 years and older, and I ask them if I can leave my postcards there. I had we dropped postcards off in this place in August of last year, and people are still calling me from there. Where else can you go? Go market at dialysis place. That's another good place. If you have clients in the waiver program, get those coordinators' cell phone numbers and start sending text messages out to the coordinators maybe once a week to let them know, hey, if you have any clients that need my services, I'm available. Good evening, Shining Hearts. How are you? You said you're new here. Well, welcome, welcome, welcome. Memory Care. Is that the name of your agency? May I ask what state are you in? I am in Pennsylvania. Not a problem. Yes, I am in Pennsylvania, and we're probably one of the lowest paying states as far as Medicaid and the waiver company is concerned, which is absolutely sad. Okay, you're in Philly. Okay, what part of Philly? Oh, well, if you're in Philly, I'm going to give you a tip right now. Shining Hearts, do you have K in our home care in New York? Oh, in New York. Welcome, welcome, New York. Shining Hearts, what part of Philly are you in? New York, I heard, was very challenging for home health care. Aren't they trying to, either the state or someone trying to govern all the home health care under New York? You're in Uptown. Okay. Okay. Uptown. Okay, I'm confused when you say Uptown. My agency is actually in Germantown. I'm going to tell you where you could go get clients from. 52nd and Parkside. 52nd and Parkside is the main waiver office where all the waiver applications go from all of the welfare offices. So if you go down there like twice a week and spend you about 2-3 hours, you're going to walk away with at least 5 to 10 leads for waiver clients. I actually had a client that called her coordinator right there on the spot. Oh, Cheltenham. Yeah, okay, you're up near West Oak Lane. Okay. You know where you could go? You could go to Motor Vehicles right there on Ogons Avenue and pass out some flyers at Motor Vehicles. That's a good place to go. You could go to the ShopRite supermarket, especially, the first of the month and earlier in the day. A lot of seniors are doing their food shopping. If you're in Cheltenham, you want to get private clients, go up like you're going to Jenkintown. What is that? Washington Lane. And Washington Lane turns into 611. It's a lot of apartment buildings up there that have seniors. You can get clients. I'm a nurse practitioner, so I'm trying to decide which route to take. Open a practice or an agency. Oh, that's a good one. That's a good one. Guys, tap the screen, show your love. Let's get some hearts going. And share this live out to other people. And please go up and grab your deli heart. Thank you. I appreciate it. Shining Heart, that's a good one. A practice or an agency. Well, this is what you have to ask yourself. Which one do you think that you'll be able to start up faster? And really, where is your passion? Now, are you going to be non-medical or are you going to be skilled nursing for your agency? That's another thing you have to think about. Guys, thank you for the hearts. Thank you through the hearts. Please go up and grab your deli hearts. And if you guys can do for me, it's only a penny. If you can hit that popular live, that will help us a lot because that will get us out there and get people knowing about that the live is here, because we're trying to invite as many home healthcare agency as we can, because what I'm trying to do is build a community to where we can have a support team and we can be talking to one another. We can be bouncing ideas off of one another and teaching one another of different ideas, even as far as marketing, what's working for you. How are you going about getting clients? Another thing that they do, which is big in the city, is some home health care agencies will have like a big barbecue, or they'll give out food in front of their agency and they'll pass out flyers. That's big in the urban areas. Shining Heart, what is your goal? When are you thinking of launching? Have you made a decision yet? Okay, and Golden, you are in Atlanta. I do senior mobile care. Oh, see now, somebody like that, you would do really good, Golden, with getting clients for an agency and becoming a recruiter for a home health care agency. Since you're doing the senior mobile care, you're working with seniors every day. You could start making yourself a what am I trying to say? Another stream of income. So if anybody is here that has an agency in Atlanta, you might want to connect with Golden. What is that? Curl. Because she has a senior mobile care, beauty mobile care. I would like to get it going. Oh yeah. I would say try to get it going as soon as possible, most definitely. But you have to make a decision on what direction are you going to go. If you're going to go with the agency, I say, the agency is a winner because of the mere fact that people are always going to need care and people are wanting to stay in their homes more. Guys, can we tap the screen? Can we get some hearts going, please? Let's please show some love and some support, and let's get those hearts going up. And grab your deli heart up at the top to show your support. I would appreciate it. And please share this live with other people. Because we want to start building a community. Curly, do you travel? Okay, Shining Hearts is asking a question. There we go. That's what I'm talking about. That's what this group is for, to network with one another. Awesome. I hope you, Shining Heart and Golden Curl, you guys can network with each other and follow one another. Crystal, thank you for joining. This is a live talking to people that own their own home healthcare agency or looking to start. This is a Q&A to be able to ask questions. And also to be able to network with other home healthcare agency owners. We want to build a community and work with one another because this industry can get a little stressful. It can become overwhelming, especially when you're first starting out. Do you offer skilled? We do both. We offer skilled and non-skilled. But right now, our non-skilled is what is thriving the most. The skilled, we're still waiting for the paperwork to finish going through with that one. But people are wanting to stay home more. And what we're finding is that the government will rather pay to have someone go into someone's home and take care of them 24 hours a day as an aide versus them going in a nursing home, because what it costs a day in a nursing home is almost what it costs for a week for an agency. And people don't want to leave their homes anymore. People want to stay in their homes. Is it less expensive to be home for sure? Oh, yeah, it's definitely less expensive to take care of people from home. And people enjoy it, especially when they have the right aide, someone that's going to service them and care for them. One thing that I have come to notice with seniors is that when they feel as though someone is really looking out for their best interests, they get more comfortable. They'll refer you to other people, and that's how you continue to get clients. I get a lot of referrals from my clients. They're always calling me, hey, Rob, and my aides. That's another thing you could do too. Your aides, you can offer them a bonus if they refer someone to the agency. You want to take care of your aides, especially when you have good aides. What I do is, especially my aides that are good, every once in a while we'll give them gift cards for like $50 just to say thank you, just to tell them that we appreciate them. because your aides are like walking billboards. And then if you say to them, hey, would you think about making another stream of income, because I'm looking for a recruiter, and offer them $250, $300 for every client that they bring in as a recruiter. You got to make sure that they have a job title, because you don't want any issues with Medicaid. Okay, because Medicaid don't want, frown upon kickbacks. So you got to hire them as a recruiter, even if they are an aide, if they're going to be bringing you clients in, so you can pay them for recruiting for you. That's another way that definitely matters, because it's so hard if you don't have. Yes, yeah. Your aides are key. And see, what I do with my aides, because a lot of my work is remote. Even with interviewing, my aides is remote, because what I do is all over Zoom. What I do is I have my aides interview with the client. They interview with me, and then I have them interview with the client. I let my clients have a say on who their aides are going to be. And I will send like 3 caregivers over there, because I think I don't necessarily agree with, because someone is in a waiver program, or someone needs a home health aide, that someone should just knock on the door one day and say, hi, I'm your aide and I'm here to service you. I think it's good to allow the clients to have a say on who is going to be their aide. Patient choice. Is that going to be the name of your agency? Patient choice. Yes, absolutely. The patient should have a choice and a say on who's their caregiver, because you know what? It actually helps you. Because like I said, I had one client and she was very, very difficult to please. And she went through 16 aides. And I started allowing her, she was the first person I started letting her interview. Hold on. I got to put this puzzle together. Interview who was going to be her aides, because I didn't want her putting it on me. Oh, you picked this aide, you picked that aide. No, you have a choice in it also. Guys, keep tapping the screen, please. Let's get some hearts going. Let's share this live out to people. And if you could go up there and you could grab your deli heart, I would appreciate it. Okay, you are a case manager from South Carolina. Okay, what part of the Carolinas are you in? Welcome. I used to go to the South Carolinas all the time. Thank you, Shining Heart, for liking this live. And guys, please show your love and like the love and share it out with other people. And for a penny, you could grab that popular live, and that gets us out and lets TikTok know that this is informative. Oh, Columbia. My girlfriend lived in Columbia. Her name was Sandy. She actually was a line dance teacher. And she used to have something called the Red Ball down in Columbia, South Carolina. I would go down there every summer. Nice, the Carolinas. The Carolinas is a complete different world than it is in Philadelphia. Even though you guys have a lot of Northerners going down south, and the down south is really, really growing. So do you have an agency, Tyra, down there? Or are you starting an agency? Guys, thank you very much for liking the live. And please go up and grab your daily hearts. That shows your support. Especially if you feel as though you're getting some information, creating my own. Okay, very good. Okay. Are you going to now in the Carolinas, do they allow you to start your agency out your home, or do you have to have a commercial building? Thank you very much for the heart, Tyra. Oh, thank you. I appreciate that. Because up here up north, you can start your agency out of your home. Oh, you guys have to have a building. Wow. Okay. So you really got to have a good plan. And I would recommend, Tyra, that you start your marketing early, because you would want to get you a waiting list of people before you actually open those doors, because you're going to have to start paying that rent right away. That's a shame. Well, that's the good thing that we have up here in the north. We could actually start in our home. We just have to make sure that it has a lock on the door that we're using as the home office. But I have a home office and we have a commercial location. Guys, thank you very much for liking the live. Please continue to tap the screen. Continue to tap the screen. Oh, okay. So, Tara, that's what you're doing now. You're marketing. Yes, start reaching out to the hospitals, start reaching out to the rehabs, start reaching out to the dialysis centers. Go and meet with the administrators from the hospital. Find out if you can offer a luncheon for the social workers. You know, you got to spend money to make money. You know, do a luncheon and offer your services. You know, make sure you have your presentation down pat, even if you got to stand in the mirror and you got to practice. So if you got to call me, you know, we will do some role playing. You know, it's all about presentation. Presentation is key. Your first impression is your last impression. You got to make sure you know your demographics. You got to make sure you know your competition. What is that other agency offering? You got to make sure you're available. I had one of my aides say to me, she said, "Do you always answer your phone?" I said, "Yes, I do." I said, "Even when I see their number come up and my eyes roll, I still would answer the phone for them, because you got to let them know that you are available, because that's another issue with agencies. They say they can't get people on the phone that clients have. I have a lot of contacts. Very good. Well, keep them contacts warm and start you an email campaign. Start sending out emails right now, letting them know opening soon, letting them know what your services are. So that is really good. Guys, please grab your deli hearts. Grab your deli hearts. That supports me as your host. And keep tapping the screen and share this live out to people. That lets TikTok know that this live has some valuable information. My plans is that I'm going to be coming on every day except for Thursdays to give you guys information. Absolutely, Tyra, we can definitely connect. Anything I can do to support anyone. I have been an entrepreneur for 34 years. I have been in the home health care industry since 2023. I also help home health care agencies get funding and also business credit, because that's something that you guys are definitely going to need, especially while you're waiting for the funds to come in from the state. So if you guys need any help with that, I can get you guys set up with that also. I was a DM for one and always answered my phone after hours and weekends. Yeah. Answering your phone is key, especially for your aides, especially for your clients. But I'm really fortunate. Once after a couple months with building a rapport with your customers, the clients, I typically have to call my clients. I don't have too many clients calling me because I check in with the aides. Like I said to everyone, I have all of my aides on WhatsApp. And I have a WhatsApp community, and my aides, after they do their chores, they have to take a picture. When they do their blood pressure, they have to put the reading in the blood pressure. If they have a doctor's appointment, they have to put that in the WhatsApp chat, because that allows me to stay up to date on what's going on in each of the clients' houses. So when I call the client, I'll be like, "Oh, so how was your doctor's appointment? Oh, I heard your blood pressure was down a little low. Or I heard you wasn't feeling well today. What's going on?" So you might want to take advantage, if not the WhatsApp, start some type of chat that you can have going on with your aides, so you can be in contact with your aides throughout the course of the day. And it's easier to be able to manage the WhatsApp instead of having a bunch of aides calling your phone, blowing your phone up. Thank you very much, guys, for showing your love. Yes, please show your love, and please go and grab your deli heart for today. And let's share this live out to as many people as possible. Wow, I don't believe I've been on here for an hour. That is absolutely crazy. This is the first live that I have done. Oh my goodness, that went by so fast. So guys, come on, throw me some questions. I'm here to answer your questions. Oh my goodness, I'm actually impressed. I did it live for over an hour. Oh, this is really cool. This is going to be fun. Guys, I'm going to help you as far as getting set up so you can get VA clients. I'm going to help you guys as far as getting you some workman's compensation clients, help you with some marketing. You need me? Guys, give me 1 second. What you gonna get? That's fine. That's fine. We ordering some Chinese food over here. But help you guys as far as does it show how many hearts I've sent? No, it doesn't show that. It just shows what the total is. But guess what, Shining Hearts? I've been seeing your hearts coming, and I appreciate your support. I really do. How did you get started? Well, how I got started was actually because of my own health journey. I am disabled. I have to have 6 surgeries. I live in chronic pain. I have been having health issues since 1997. From 1997 to 2010, doctors told me it was in my head and I was seeking drugs. I was diagnosed in 2010 with fibromyalgia. Then I had a seizure in 2010 from a side effect of tramadol and dislocated my shoulder. And they said that the only reason why my shoulder was still in place because that's how much arthritis I have. And then the next week, my hip started hurting. And they told me I needed, so at 40 years old, I needed a shoulder replacement and a hip replacement. I'm 56 now. Now, both of my knees are going bad. All the bones in my feet have collapsed and they're laying on my ligaments. So I have lived in and out of different rehabs, dealt with different doctors, and I didn't like the care I was given. So that was what my motivation was to start a home health care agency, because I wanted to be able to give people good service. Because I wasn't experiencing getting good service. I wasn't experiencing people listening to me. And I tell people all the time, you don't know how it feels to want to get up and get a cup of water, but you're in so much pain that you can't do that. You understand what I'm saying? And to have an aid, to someone assist you, is big. It's very helpful. And even though I live in chronic pain, I've serviced a lot of my clients, and I've had my clients say, Robin, with all your health issues, you better than, these younger girls that we have, out here. But that's what made me start, because of my own health journey. I took care of my mother. And I also have spinal stenosis. My mother had spinal stenosis and she lived in chronic pain. And I was taking care of her since 2012. She just passed away January 17th of this year. My thing was, I didn't want my mother to go in a nursing home. We was going to care for my mother. I cared for her. I changed her Pampers. I washed her. I did whatever I had to do to, take care of my mother. Yeah, Shining Heart. It's been hard for me because it would have been easier for me to deal with her death if she passed from health conditions. She passed away from a side effect of a medication she was on because she had a stroke, and they put her on this medication that was supposed to, I forgot the name of the medication, but it caused her to have a brain bleed. And literally within 3 hours, my mom was gone. She was gone. She had woke up, she had a stroke, and my daughter called me. She said, Mom, go downstairs, check on grandma. She was like, something's wrong. So when I went downstairs, she was slurring at the words, and she was just crying and crying and crying. And my mom was a strong woman. She didn't cry. You know what I mean? We called the ambulance, got her to the hospital, and they immediately took her for a scan. And when they brought her back, they basically told us that there was nothing that they would be able to do to stop the brain bleed. She knew she was passing. And it broke my heart because she just cried. She just kept saying, my babies, my babies, my babies. And I was like, Mom, we're going to be okay. We're going to be okay. So, you know. But anyway, back to you guys. As an entrepreneur, I just want to share insights on running a home healthcare agency, and show you guys the way to be successful, and the way how you can have yourself a pipeline and you cannot be struggling. Because see, what happens with some agencies is they'll be busy for some time and then they'll get slow. You want to be able to constantly have clients coming in on a regular basis, and the only way you're going to do that is if you build relationships. So get out in the streets, make your relationships, talk to people, especially these caseworkers. Make these caseworkers, your best friends. When you sign someone up for a waiver program, get that coordinator cell phone number so you can send messages out to them. I even have virtual business cards that I had my assistant make for me. I am so mad that I can't show you guys this stuff. It's on my phone. I don't know how to do the share screen, but I have a virtual business card that I made. And when I meet someone, if I don't have a paper of advertisement to give them, I get their phone number and I just text them my business card. So you guys might want to look into creating yourself, if you have Canva. If not, there Google virtual business cards is actually platforms where you can have the virtual business cards. You can have your website linked to it. You can have your YouTube linked to it, and you can just share it with people. And that will always stop it in case you don't have a business card on you. Because I'm not a pocketbook person, so I don't carry pocketbooks. So long as I have my phone, that's how I share it with people. Thank you for joining, everyone. I appreciate everyone for coming on. I appreciate all the hearts. We are up to 3,600 hearts. Thank you, thank you, thank you. I appreciate it. And if you guys could grab those deli hearts before you leave, I would truly appreciate that too. That supports me as a host, and it supports our live when you grab those deli hearts. And if you become a fan club member, you will always get notification when we are about to have a live. And what I tell you guys is I'm going to try to be coming on every day at 7 p.m. except for we're filtered to the protect the community experience. Oh, it says some comments were filtered to community. Okay. Thank you for the heart. Thank you. I appreciate it. But I'm going to be trying to be coming on every day except for Thursdays at 7 o'clock. So if there's something you guys need from me, a topic that you want to talk about, you guys can send me a DM and say, hey, Robin Michele, when you get in live, can you talk about how we can get VA clients? or can we discuss more about marketing and advertisement? Because I want this to be that when you walk away from this live, that it's informative, that you feel that you walked away with something. So I want to open the floor up to anyone that has any questions about starting an agency. If you're having any obstacles that you're having within your agency, put the questions down. Let's talk about it as a community, and let's see how we can support one another, because this is one of the most rewarding careers you can be in, owning your own home care agency. My notifications are on, so I stay connected with. Okay, perfect. Rewarding that you can be in, being able to care for someone, because having a home healthcare agency, you're not just servicing the elderly. You can actually service anyone, over the age of 21 that has some type of disability or needs some type of services. And that's another thing I want to share with you guys. Make sure you also hit that Social Security office up too and pass out your brochures and your flyers. I had to go in there and get a Social Security card, and you will be surprised how many people I talked to and how many people were in there. Make your networks. Even talk to other home healthcare agencies, because what's going to happen is you may have UPM or Keystone. Somebody else may have PA Health and Wellness. You may not have all the licenses when you first start out, because they don't approve them, they take a long time to approve. So if you have another agency and you guys have different insurances, when you guys get clients, you can swap with one another instead of losing a client. But guys, hi Wanda, how are you? Is this Wanda? Okay, so before I end this chat, does anyone have any questions? Any questions about starting a home healthcare agency, getting your license, doing marketing, any caregiver questions, any questions that you may have? And another thing I'm going to tell you guys, go into Facebook, okay? And if you live in Columbia, South Carolina, search Columbia, South Carolina, and find that group that's in your community, and start posting in that group. And there's a lot of groups in there. Thank you for the heart. Thank you. It's a lot of groups in there for elderly looking for senior care. There's also groups in there for social workers. You want to join those groups, because you can put out, hey, I own Healing Hands in Columbia, South Carolina, looking to network with social workers. But you want to make thank you, Legacy, for the heart. I appreciate it very much. Where are those groups at? I just got on. Okay, so that's Facebook. So you want to go into Facebook, and you want to search for groups. You want to search groups for senior care. Wherever you live at, if you live in Philadelphia, Pennsylvania, we got areas called Germantown. You want to put Germantown up. Put the name of your city, your town, your county in there, and find those groups. You also want to find groups that have social workers in it. You want to find groups that have nurses in it, and you want to start marketing in there. You want to start lessons that you offer, so you can start building relationships. Welcome, Gail. Welcome. Build those relationships. When you're calling the hospital, you gonna ask if you can be connected to the social worker department. 9 out of 10, you're going to get a voicemail. Or you're going to get someone on the phone, and they're going to say, just email me something. Make sure you're collecting emails so you can start an email campaign. and you want to send them out an email like at least once a week of your advertisement, the services that you do. You want to make sure when you're making your presentations at these rehabs and these hospitals, you don't say what everyone else says. My line is, we're open 24 hours a day. I am always available. My phone is always on. We help people get set up. If they need waiver services, we will do everything for them from A to Z to get set up, because I find that a lot of people, when they try to get on the waiver program themselves, it takes them months and months and months. What I do, when I'm signing someone up for the waiver service, I sign all my clients up. I actually make the phone call to the waiver company myself, and I put myself down as an authorized representative. That way I can call in and I can find out what's going on. Now, doing that, you're going to have to follow up, and you're going to have to call them. Hey, I'm calling about, Rob and Michele. Is there any updates on her waiver application? They'll go in and say, oh, well, the welfare office is still looking for proof of fund for them. Then you need to call the client, because number one, it'll take about 2 months for them to get through the waiver program. You want to stay in communication with that client while they're waiting for the waiver program to get through, because if not, another agency can scoop right in and take that client right from you. Guys, please continue to tap the screen. Thank you very much for showing love and sharing, for everyone for sharing this out. And if you haven't, go up there and grab your deli heart. I would appreciate that. But that's what I'll tell you about the waiver program, that you want to make sure that you put yourself as an authorized representative. That way you can call, you can follow up, you know what's going on. Won't nobody slip through the cracks. You want to find out what the income guidelines are for the waiver company. Like for Pennsylvania, they can't make over $2,904 a month. So when you're talking to people, if they're going to go through the waiver program, you need to find out. We have what's called the Philadelphia Aging Corporation. You need to find out what is the corporation for aging and seniors, because they also pay for they reimburse people, seniors, for when they have AIDS. So that's another contact that you want to make also. What else can I tell you guys? Any questions? I love questions. I have been in the home healthcare industry since 2023. I started because of my own health journey. I will tell you that Nextdoor, I shared this, and anyone coming on that's new, Nextdoor is an app that you can download out of the Play Store. That is an excellent place to get caregivers from, and also to get clients from. You can make yourself a business page in there, and the Nextdoor app, it's going to show it to people in your community and surrounding areas, because that's what you want to get. You want to get service clients that's like, for me, I like to service clients that's like in a 10-minute radius from my office. I end up going outside of that location because I was getting referrals. So if you go on Nextdoor and you're marketing on there, you're going to get people right there in your community. So check out the Nextdoor app. Make sure you go on Facebook, join those groups, join groups in your community, join those groups with those social workers, whatever. If you live in Columbia, South Carolina, put in there Columbia, South Carolina, and they'll have a group just for Columbia, South Carolina, or or your county. Put it in there, mark it in there so you can get clients, because the more free advertisements you can do for your agency, the better. I will tell you, for 2 years now, I have done no paid advertisement for my agency. And my first 7 months, I made $1.1 million. I just got started my home care. I don't have any clients yet. Thank you for the advice. Oh, no problem. And if you have any questions, you can always DM me. I'll be here to assist you. And you know, I always have my phone on. I'm a night owl too. But yeah. So what state are you in? And how are you marketing to get clients? Can I make flyers and drop them off? Absolutely, you can make flyers. You can, but listen, I don't have any on me. I recommend you get postcards. Okay? Do postcards. Because if you think about it, one 8x10 sheet, you could get 4 postcards out of one 8x10 sheet. Okay? So make postcards. Design both sides. You can go to Vistaprint. Do you have forms that need, do you have the forms that you need to start running my business? I don't understand your question. Do you have the forms that you need to start running my business? I'm sorry, Legacy. I don't understand your question. And you can always DM me also. But like I was saying, get postcards made because you get more for your money. Running the business. And you can always stick your postcards in your pocketbook, in your coat jacket. They're always convenient. Stick them on the side of the car. And you always have them and you can pass them out. Where can I market my senior care beauty? You need to hit up different agencies. Golden Curl. You need to Google home health care agencies in your zip code area, like intake forms. Oh, you need intake forms. And okay, you're in Connecticut. Okay, Legacy, you're looking for intake forms. So do you need samples of intake forms? Legacy, I'm going to get back to you. Okay, welcome Connecticut. Okay, for policies. Okay, so you need your policies and procedures. Golden Girl, back to you. You want to almost work like an agency. You want to home health care agencies. You want to reach out to nursing homes, Golden Curl, and let them know that you are a mobile hairdresser. Okay, because you could probably actually pull right up to the nursing home and they could come in and you could get you some clients then. DM me, Golden Curls, because you could blow up real easily. You got the rehabs, you got nursing homes, then you got rehabs that people go stay at least 30 days at, and people be wanting to get their hair done. Now, as far as Legacy, you're talking about the policies and procedures. Do you have the forms that need to start running my business? Okay, so you are looking for policies and procedures? Yes, okay. Okay, awesome, Golden Curl. Okay, if you're looking for policy and procedures, you need to DM me. That is a service that we do provide, helping you get your policies and procedures. Hi, Tina. How are you? Welcome to the chat. Guys, please, before you leave the chat, go up and grab your deli heart. That supports me as your host, and I would truly appreciate it. Guys, do you believe I've been on here for an hour and a half? Like, I have been scared to death to go on live. I cannot believe I've been on here an hour and a half. It has been like awesome. Hello, I'm doing good. Thanks for asking. Oh, welcome, Tina. So, Tina, do you own a home? Okay, Legacy, you just DM'd me. Good. Do you have a home health care agency? Thank you, SW Hart, for the fan club. Thank you, guys. Thank you. Thank you. That makes me feel so special when I get my hearts and my deli hearts. And guys, share this out. Share the group out, the live out to other people. And for 1 penny, you guys can go in and you can grab that popular. Oh, thank you. Thank you for the deli heart. Thank you, guys. I don't want to mispronounce your name, but thank you so much. Yes, I'm trying to get everything started now. Okay, and Tina, what state are you in? Guys, thank you so much for the daily hearts. Thank you. I'm going to here's my heart back to you guys. That just made my day. All right, that's telling me I got a couple new messages. I don't know. Mississippi, and I want Florida also. And Virginia. Okay, Virginia. Okay, I got family in Richmond, Virginia. Mississippi and Florida. Florida, you should really do good because that's where the baby boomers are. Guys, I'm going to tell you. Any place that you open a home health care agency, if you have the right marketing in place and you have the right network in place, and if you have the right personality means a lot. You will be very successful. Hello, can you talk a little about the UEI code? Once you obtain it, how do you use it to get clients? Hold on one second. I will give you that information. Let me grab this. But wherever you are, you should be able to do really well as a home health care agency. Like I said, especially if you have the right personality, especially if your clients know that you genuinely care about them, you will be surprised how many referrals you got. Hold on. Let me see. I'm looking for this one question, so now I'm waiting for my tablet to pull up so I can answer the question about the UEI code. Okay, here we go. Hold on one second. But do your marketing, and if you are thinking of opening an agency, I would start marketing now and say coming soon. Okay, I'm sorry. And tell people that you're coming soon to let people know. Okay, so, all right, back to who asked me that question. Where is it? Someone asked a question about thank you for the hearts. Thank you for the hearts, guys. Golden Girl. The UEI code. That's for the cage code. The cage code. That's how you get VA clients. What you want to do is you want to go to sam.gov and you want to apply for your cage code. Make sure you have your EIN information, your LLC, all of that. Once you get your cage code, then you can join in the community veterans community where you can start getting VA clients. So if you need help with that, DM me, because you want to make sure you put your application in, and they're going to want your information. Where do I join the community? Okay, well, the first thing you have to do, you already have your cage code number. Thank you for the hearts, guys. Thank you very, very much for the hearts. Do you already have your cage code? Oh, you do. Okay, so what you do is DM me, and I will share the information with you. I filled to the state to get my credentials and get licenses. Okay, very good. Okay, so you're doing your credentials for your agency now. Awesome. I can't say your name. I apologize. I don't want to pronounce it wrong, but very good. Keep going. So you don't go through the VA you can go through the VA website, but I actually have a phone number that you can call and you can speak. No. The first thing you got to do is get your cage code. Then once you get your cage code, then you can go through the VA. Okay? And Some of the VAs have a third party company that they work through, and you got to go through them. And sometimes it takes a couple months before you're actually in the system. That's why you need to DM me. And I can I have a lot of the research on my desktop computer. I can let you know who you need to reach out to. But yeah, you want to get those VA clients because they pay a little bit more. How do you get... Okay, someone just said, how do you get KG code? You mean a cage code? L? Someone named L? Are you asking me how do you get a cage code? If that's what you're asking me, you go to sam.gov and apply for your cage code. You need to make sure you have your EIN number, and you need to make sure you have your LLC available with you when you apply. Guys, if you could go up and grab your deli hearts, I would appreciate it. And if you could keep tapping the screen, I would also appreciate it. And I want to let you guys know, I truly had a fabulous, fabulous, fabulous time on this live with you guys today. I've actually been on here for an hour and 37 minutes. I never thought I would be on live. I have 2 TikTok accounts because I have a funding company. I do business and personal funding. And if anyone needs any business funding, business credit, make sure you send me a DM also. My company is called BP Funding Tree, and I went on live there a couple times, and I was only on there for like 10 minutes and jumped off. But the home health care industry is like a personal passion of mine. That I have because of my own health journey. Thank you very much for showing the love. Thank you for the hearts. Thank you guys, everyone that grabbed your deli heart. And like I said, I'm going to try to come on every evening. I only have I am from Pennsylvania. I am from Pennsylvania, and we service Philadelphia County, Chester County, Delaware County, Montgomery County, Philadelphia County, Chester County, Delaware County, Montgomery County. Yeah, I thought we had 4 counties we service. So that's another thing. Okay, you said I only have a PCA, not a CNA. Okay, that's okay. I don't understand, Golden Girls. You said you have so you do a personal care assistant? No CNA. What is your question that you're asking me? Oh, good. I have family there and go there often. Only 3 hours away. Okay, you're only 3 hours. Are you in Connecticut? Are you the one that said that you were in Connecticut? I actually was in Stamford, Connecticut for 6 months during COVID. Guys, grab your deli hearts. Grab your deli hearts before you leave and keep tapping that screen. I love seeing those hearts come up. It makes me smile. You guys are truly made my day. You're going to make me want to definitely come on. Okay, Connecticut. Nice. Yeah, you're only a couple hours away from Philadelphia. Yes, you guys are going to make me want to definitely come on every night. I hope you guys come on and listen. If you guys want me to talk about a certain subject on live, make sure you send me a DM earlier during the day so I can be totally prepared and I can ask any questions that you have. Or throughout the course of the week, send it to me. That way I can cover it. And I'll send you a DM and let you know when I'm going to be on live. But I'm going to try to come on every night at 7 p.m. Eastern Standard Time. LT, thank you for joining. Thank you for joining. And thank you everyone for coming. I want you guys to know that I truly appreciate each and every one of you. You are doing a very important job, and that's in the home healthcare industry, and that's taking care of our seniors. Some of us are taking care of people under 50 years old. Me being a person that is disabled, I want to say that, I want to thank you for the service that you're doing, and keep up the good work. Sometimes owning a business can be very exasperating, very stressful, but you have to just be determined that this is the industry you want to be in, and you want to be a success at this. And you have to build yourself a network. How do you build a network? You start talking in communicating with people in this chat. I'm going to start having panels up soon of people that are interested in being mentors. If you're interested in being a mentor, or if you need a mentor, let me know, because it's all about working together, supporting one another to get our business to the next level. You want to make sure that your business is protected. You want to make sure that you even have your business in a trust. We're going to talk about that in another episode. And you want to make sure, if you have any partners, you want to make sure that you have your Kingman's insurance. You want to make sure that if you are the breadwinner, that you have life insurance on yourself. So if anything happens, your family is taken care of. It's a lot of responsibility as business owners that we have to take care of, and make sure we take care of our families. And make sure you follow up with your clients. Make it a point that you're going to say, okay, every other Monday, I'm going to get my list and I'm going to call each and every one of my clients. As I share with you guys, I have a WhatsApp chat. Matter of fact, I'm going to open it right now. I got my tab is going to die on me in a minute. Make sure I have a WhatsApp chat, and with all of my clients, all of my aides in it. And I communicate with all my aides. Everyone has to sign up to the WhatsApp chat. And when they go in, they take the client's blood pressure. They got to put the pressure in. When they do laundry, they have to take a picture of that. If they vacuum the living room, they have to take a picture of that. If they clean the bathroom, they have to take a picture of that. They have to give me a summary of what went on throughout their shift. If the client isn't feeling well, they need to go into the chat and they need to put that in the chat. I'm trying to actually, before my phone dies, we have a chat that way. I have a chat for the schedules. We have a community chat. So if it's announcements that have to be made, like, see, this one is, see, this is like one of my WhatsApp chats. See, that's the name of the company, WhatsApp. And we're on WhatsApp. And, if you got your phone or your chat next to you, you know what's going on with your clients at all times. That way you can call your client. Hey, I heard you had a doctor's appointment yesterday. How did it go? Or if the client wasn't feeling well, you could call them. Hey, I heard you wasn't feeling well today. What's going on? What else can I say? So any questions? Let me see. Did I miss any questions? Nope, I didn't miss any questions. Yeah, you don't have to use WhatsApp. You can use the Yahoo chat. But the biggest issue that a lot of people that I bring on board is they complain about the aides and say the issue that they had with the other agency is the aides weren't doing nothing but sitting on their phones. So I want to make sure that my aides are working. That's why I have the chat. I mean, it doesn't control everything that they do throughout the day, but it does basically allow me to be able to monitor what's going on at all times. But guys, if anyone doesn't have any wait a minute. Does anyone have any questions? Any questions? Any questions? Because I'm going to be ending this out soon. So this is your opportunity to have questions that anyone wants. They can always DM me later. If you would like to set up a consultation call, we can always schedule a one-on-one consultation call. And I can assist you in any way. My goal is to try to help as many owners be successful and build them up a network so they can constantly have their phone ringing and constantly getting clients, because I want all of you all to get to those 7 figures, because it's not difficult. Especially if you get the right clients. And that's the thing we're going to talk about another day, on making sure you get the right clients. I have one woman, she had 40 clients, but they all were like 4 and 3 hours a day. You want to get you clients with 12 hours a day, 10 hours a day, 8 hours a day. Those are the type of clients you want to get so you can really see the benefits of your business. But guys, I am about to say good night to everyone. Thank you everyone for coming on, and I will see everyone tomorrow. I will be back on at 7 p.m. So if you have any questions, come on tomorrow, and everyone have a good evening. Thank you very much. I'm about to end the chat. You guys have a wonderful day. Good night. Good night, everyone. Good night.